Assalamu alaikum. I'm Dr. Ahmed Lotfi. I'm Senior Consultant Obstetrician and Gynecologist. I've been practicing in UK, New Zealand, and in the Middle East. My qualifications are MBCHB, Master's Degree, and MRCOG. This is a case of postoperative complication, pulmonary edema. When the patient develops confusion, breathlessness, tachycardia after recent gynae surgery, we should suspect pulmonary edema. Usually the patient is breathing with difficulty, or there are crepitation with auscultation and low oxygen pressure, less than 94%. So it is a quick diagnosis of pulmonary edema after major gynae surgery. If we have a portable X-ray machine, we can do a chest X-ray, and it shows a clear picture of pulmonary edema. This is likely due to fluid overload. So the diagnosis should be quick, and it is a life-threatening condition. This condition could be due to overload with fluids or sepsis, pneumonia, but most likely in post-operative it is pulmonary edema. Also, it can happen due to pulmonary embolism. If there is breathlessness with confusion and no or low oxygen saturation, no infection, no signs of pulmonary edema, it could be pulmonary embolism or cardiac failure. Investigation: full blood count, use and ease, and blood cultures, chest X-ray with portable X-ray machine, arterial blood gases, or even finger blood gases, ECG if we suspect cardiac failure. Oxygen therapy with continuous monitor and restrict fluids, IV diuretics, furosemide, and treat sepsis with antibiotics. And these patients should be treated in ICU, and they may need ventilation if they stop breathing. Key points: post-operative patient should be under strict observation. If there is confusion with hypoxia, so this case is a life-threatening condition. Could be pulmonary edema, pneumonia, pulmonary embolism, or cardiac failure. Pulmonary edema may result from fluid overload, sepsis, or cardiac failure, and it is sometimes happens in obstetrics and in gynecology. The patient presents with severe bleeding and shock, and treatment with fluids may lead to pulmonary edema, especially if the patient with preeclampsia, eclampsia syndrome, because pulmonary edema is one of the complications of this syndrome as well. Careful fluid balance monitoring is essential post-operatively. So post-operatively, careful input-output of the fluids is mandatory, and strict patient observation with respiratory rate, breathing, oxygen saturation, vital signs is important in the post-operative, especially after resuscitation from shock in obstetrics and gynecology. Rapid recognition and treatment is important for saving this patient's life. It will reduce morbidity and mortality. Thank you. This is the end of the presentation of a case with pulmonary edema.